All right, good morning, everybody. We are ready to start the Medicinal Use Subcommittee meeting. Today is July 10th, 2024. It's 9 a.m. I'll take a very quick roll call. Chair Sarah Payan.
Here.
And Antonio Fraser.
Present.
All right, perfect. We do have both of you here, so go ahead and kick it off.
All right. Good morning, everyone. The July 10th meeting of the CSC Medicinal Use Subcommittee is called to order. We have already called roll, so we won't do that. We have a quorum established. Can we do public comments on items not on the agenda?
Absolutely, we can. So we are now going to be taking comments on items not on the agenda today, which is agenda item number 2. So please keep your comments limited to this agenda item. If you would like to make a comment, please raise your hand by clicking the hand icon next to your name if you've logged into the meeting, or by pressing *3 if you've called into the meeting. All commenters will have 2 minutes to speak with a 30-second warning, and each member of the public will have 1 opportunity to speak on each agenda item. And with that, we will go to our first caller, which is call-in user number 3. I've sent you a request to unmute. Call-in user number 3. There you go.
Morning.
Good morning.
Good morning. How you doing?
Super. Go
Can you
ahead.
hear me?
Yes, can you hear us?
Yeah. Sorry about that. I was trying to log on with my computer, and unfortunately, technical issues. But happy to be here today. Just wanted to propose a revisit to Section 17300N for prohibited use products. I was interested in exploring options on meter dose inhalers and found the regulation against those. I've been attempting to get some information on specifics as to why that is a prohibited product. Obviously, my intention is to look at something that would be delivered to the public safely and provide a overall better form of administration of product without combustion, without chemicals. But I know that at least at this point, the meter dose inhaler is completely off the table. I would just like to either propose revisiting that or get some more information potentially on that and see if there's something that can be done.
Thank you.
What would
All right, is there any more public comment for items not on the agenda today? If you have a comment, please raise your hand by clicking on the hand icon next to your name. It's a little early. Or if you've logged onto the meeting, or pressing *3 if you've called into the meeting. Dr. Yafai, I've just sent you a request to unmute.
Dr. Sherry Yafai. I am a medical cannabis physician who was recently awarded a grant through the DCC. Thank you so much for that, which we are working on. But it has something that I've brought up in the past before is that we really do need physicians' voices on the DCC, especially in the medical use department, where this is such an unfortunate situation in my eyes that we don't already have physician voices here. It is entirely a perspective that is inherent to patient protections, as well as to provide for the medical aspect of use. As we are seeing the federal government potentially opening up and rescheduling, this is even more important. I have encouraged other physicians as well to apply to the DCC for the medical subcommittee, and none of us have heard back from this organization. We really, really encourage strongly a physician's voice here on this organization. Thank you so much.
Thank you. All right, is there any more comment for items not on the agenda? Last call. Dominic, I've just sent you a request to unmute.
My name's Dominic. I'm from Infinite Chemical Analysis Labs. One thing that I think would be super important on the medicinal use side, and I've said this in other advisory committee meetings, I think that all patients should have free access to COAs. We have seen, or every analyte has a specific action limit with the exception of category 1 pesticides. For these medical patients, I think it's very important for them to know what is in their cannabis that they are purchasing, whether it has below LOQ levels of category 2 pesticide, lead, arsenic, cadmium, mercury, all at passable amounts. That's all very important information. I don't think that it makes sense that only the dispensaries have to hold on to COAs, but don't have to give them to the public, especially in light of the recent LA Times article that has shown that there are contaminated products on the shelves as of now, and information that these patients deserve. Thank you.
Thank you. Kelly McCormick, I've sent you a request to unmute.
Previous caller said, and the LA Times article was so disturbing and I think very harmful for the regulated market. We're trying to portray the regulated market as something that people can trust. And when that trust is eroded, what's left? And so there need to be more safety standards for the labs to make sure they are independent, not working in conjunction, i.e. being paid for good results by the manufacturers. And products need to be pulled off the shelves immediately if pesticides are to be found. The entire testing system and the track and trace have all been exposed to be incomplete and not as dependable as they are portrayed to be, and that must be addressed. Thank you.
Thank you. All right, at this time, there are no other commenters. Would you like to close comment on agenda item number 2?
Yes, let's close comment. Thank you.
All right, very good. All right, we move on to agenda item number 3. Thank you.
All right, so we are going to be moving on to cannabis pet products. The DCC is requesting feedback from the subcommittee on the implementation of Assembly Bill AB 1885, which expands the Medicinal and Adult Use Cannabis Regulation and Safety Act to include regulation of cannabis products for animals. The DCC is required to develop regulations for these products by July 1st, 2025. The DCC has posed numerous questions to the subcommittee and public, which can be found in today's meeting agenda and are now up on the screen. Committee, any comments before we open up to the public for comment?
Nothing for me.
Okay, seeing that there are none here, let's open up the floor for public comment on this decision, or on this discussion, I'm sorry.
All right. Public comment is now open for agenda item number 3. If you'd like to make a comment, please raise your hand, and by clicking the hand icon next to your name if you've logged into the meeting, by pressing *3 if you've called into the meeting. All commenters will have 2 minutes to speak with a 30-second warning, and each member of the public will have 1 opportunity to speak on each agenda item. And with that, we'll go to our first commenter, the Veterinary Cannabis Society. I've sent you a request to unmute. I'll send it again, the Veterinary Cannabis Society. There you go. Are you able to unmute? There you go.
Good morning, Sarah. My name is Charles Lozo. I'm the chair of the Advocacy Committee of the Veterinary Cannabis Society. It is a 501c3 nonprofit of veterinarians from around the world and California focused on the safe and efficacious use of medical cannabinoids for pets. We've been acutely aware of the regulatory requirements of 1885, and we're here to assist in any way we can with the expertise of the veterinary community that has studied these cannabinoids in pet use. We have a memorandum that we have supplied that addresses these questions, and I don't want to repeat this. I want to ask you, Sarah, have you seen this memorandum? No? Yes? Okay. Well, in that regard, we have answers to each of these questions, which I will be sharing as we proceed. The society is a nonprofit, and as I mentioned previously, we have some of the best experts on medical cannabinoids for veterinary application assembled and ready to assist this committee as they formulate regulations for the pet market. Thank you.
Thank you. All right, we are taking public comment on agenda item number 3. Call-in user number 6. I've just sent you a request to unmute. Call-in user number 6. There you go.
Good morning. Thank you. I looked over these items that you're addressing as regulations for pets, and they're very good. But I would like to suggest that in light of the rising cases of cannabis hypermesis syndrome and of poisonings, ER admissions, and addiction rates that are rising, especially among our youth, I'd urge you to Am I still on?
No, you dropped off for a second.
Oh, okay. Well, my point is I'd like to see some of these same standards for human consumption as high as those that you put forth here for pets. In particular, I would ask you, this committee, to reevaluate standards for humans as you are doing for pets in these areas, the types of products that would be allowed or prohibited, especially addressing kid-friendly snacks that mimic popular food. Reevaluate adult human serving sizes in terms of safety, especially considering that underage people are consuming these products due to poor enforcement. Revisit requirements or limits for THC, THCA, CBD, and other cannabinoids in human as well as pet products. Require a label recommendation that a person consult a physician before use, and add label warnings about contraindications or drug interactions and lists of pesticides used. These are great for pets, but would also be better if improved for human consumption as well. Thank you.
Thank you. All right, Judy Strang, I've just sent you a request to unmute. There you go, Judy.
Thank you for this opportunity. I had a little difficulty wending my way through FedEx because I'm used to the agenda having the link on it, and had to go back to the actual DCC link. So if you're wondering why attendance seems to be a little low, that might be part of it. Usually we have a link on the agenda. That said, I have unfortunately within our family seen some very extraordinary, unfortunate deaths with pets regarding THC concentrated products that they bought from their local pot shop. And what I've noticed is that with animals, the result of these products goes a little unnoticed, whereas with maybe a child or a human, you might notice it and act more quickly. And what a horror it is for families to lose their pets. So whatever warnings you can improve for those products would be wise, but I just don't think anybody should be buying those products if the veterinarian hasn't suggested it to them. This taking the recommendation of somebody at a pot shop as some sort of authorities is extremely worrying. So anything that you can do at your end to make sure the warnings are clear and obvious, or even let your pot shops know they shouldn't be giving veterinarian advice to people who are purchasing products because it
30
varies
seconds.
so distinctly by size of the animal. Thank you.
Thank you.
Thank you.
All right, Kelly McCormick, I've just sent you a request to unmute.
Thank you. I agree with the recommendation for warning labels and that people need to be cautious. Often, personally, I'm the owner of 3 German Shepherds and 4 cats. And so we've been through, with that many animals, a lot of different health issues. And we have, a dog that's on gabapentin and tramadol for nerve pain. And if CBD is combined, or even something with THC, but if CBD is combined with some of these medications, it can really harm an animal. It can harm their liver. It can lead to death. And most people are unaware of that. They think of CBD products as harmless, and they don't know about the drug interactions. And so really people need to be warned, and also that drug interactions can occur. Thank you.
Thank you.
Do we have any more public comment?
Sarah, is it possible to just remind people that we are looking for suggestions on these topics specifically so that we can have a discussion furthermore about what we want to move forward? Because I mean, we have some good, I don't know, conversations, but no one's really given us hard things to consider to forward up.
Yeah, I agree, Antonio. We are in public comment in this process. We are looking for suggestions because we need to hear from you in order to help make suggestions for sound policy. So if you would please look at the topic below, and there are questions: should labels include a recommendation that a person consult a veterinarian prior to administering cannabis to an animal? These questions that we have here are our guideline, but we really do need to hear from you so that we can have some conversations and make sound recommendations that not only come from our knowledge, but it has to be a public process. So if we could please have some more comments that are pertinent to what we're talking about with the topic and the questions.
All right, with that, the Veterinary Cannabis Society, I'm going to send you a request to unmute.
Thank
Go
you,
ahead.
Nina. Question number 1, should there be specific requirements, limits around different cannabinoids? The suggestion of 501c3 nonprofit Veterinary Cannabis Society is that cannabinoids that the DCC deems safe for humans should be readily available for use in pet products. Cannabis derivatives above what is found naturally in the plant, such as THC D8 and THC D10, and all synthetic cannabinoids should not be available for use in pet products. Cannabis edibles cannot exceed 10 milligrams THC per serving and 100 milligrams THC per package. That's our preliminary suggestion. That was the question, pardon me. And our view is that the THC concentration limits of section 17304A for edibles are suitable for pet treats that are equivalent to an edible cannabis product. Section B for orally dissolving products like sublingual lozenges or mouse strips should also be safe and effective if these products come to market for pets. The limits in C regarding topicals and concentrates of 1,000 milligrams per package can be safe and necessary for efficacy in pet products. The associated requirement that these potencies be sold to medicinal use patients is a barrier, as pet parents may not hold that status when purchasing for their pets. So that's our view on the requirements and limits around specific cannabinoids. I'd be happy to continue, but I don't want to dominate. We have very specific views that impact the regulatory framework. For example, any
30
ingredient
seconds.
that should be specifically allowed or prohibited, absolutely prohibited. Xylitol, chocolate, grapes, raisin, macadamia nuts, anything containing caffeine. Same standards as pet food, FDA, CA, CDPH. Our suggestion is the same standards for pet supplements and treats. Secondarily, only allow GRAS ingredients.
Thank you, sir. Dr. Tim Shu, I've just sent you a request to unmute.
And foremost, I circulated I submitted a public comment. I don't know if that's been circulated amongst the committee members, but that is out there, and it does list my suggestions on behalf of the Pet Cannabis Coalition for the questions that are included. To provide a little bit of background, I am the president of the Pet Cannabis Coalition. We are the primary proponents behind AB 1885. I have a decade of experience in the cannabis industry, working with pets and cannabis products. I've lectured around the world to veterinary professionals, cannabis professionals, and the general public. And so I will be available during this period to be able to answer questions and provide my input and my experience based on the past decade. Thank you.
Thank you, sir. Megan Stewart, I've sent you a request to unmute.
I think there's a lot of misinformation and confusion around THC products and their ability to increase whether it's human or pet's health. So to answer those questions, I think that the labeling should 100% require a person to consult the veterinarian prior to using it for a health purpose for their pet, as well as a warning regarding its synergistic effect that it may have with other medications, as a previous caller mentioned that it may have on her pet. And I also strongly believe that it should include a warning about the signs of possibility for overdose and intoxication. So thank you very much.
Thank you. Right, we're still taking public comment on agenda item number 3, recommendations on cannabis pet products. Based on the questions. Jeff Pollard, I've sent you a request to unmute. Ooh, Jeff, you dropped off. There you are. I've just sent you a request to unmute. There you go.
A veterinarian. Also, as Charles Lozo, I am on the Advocacy Committee for Veterinary Cannabis Society. Mr. Frazier's request about specific answers to these questions are addressed very thoroughly in the document that we submitted, the memoranda of June 13th to the committee. Charles started to line by line go over them, and I would like to recommend that everybody on the committee have access to that memorandum. Thank you.
Thank you. All right. Samantha Trinidad, I've just sent you a request to unmute.
Hi, can you hear me this morning?
Yep, we sure can.
Okay, great. Just a couple of quick points. It sounds, excuse me, it sounds like there's some really good information in that memo that was brought up earlier. So just want to echo that I hope the committee does have access to it. As far as the warnings that are listed here on the screen that another caller mentioned too, I think these are really sound recommendations and common sense that they should be required to be included on the label. Last point about packaging, I think that you know, that we should consider, or it should be considered, packaging requirements that are perhaps specifically considering a pet's, a dog, a cat's ability to get into it. If not, also making the packaging requirements similar to what the packaging that you might get for prescribed medicine for your pet, so that it falls in line with the idea that this is a medical product. Thanks.
Thank you. Becky Rapp, I've just sent you a request to unmute. There you go. Becky, there you go. Go ahead.
Oh, can you hear me?
Yes, ma'am.
Okay. I too am in agreement that the warning labels should be clear and concise. Animals are of different weights and sizes, and and it should definitely be something that is that goes through the veterinarian and not just a bud tender. It's concerning that I think that it's important that we also not just look at what's on the label, but we look at what is inside the product. I'm concerned because there was an investigation by Weed Week, and they tested products sold in permitted pot shops and realized that out of 42 products tested, 25 had concentrations of pesticides above either state allowed levels or current federal standards for tobacco. So regardless of what the labels say, it is imperative that these products are tested for humans and for pets for pesticides. Going forward in the future, there has to be some sort of a greater level of testing. So anyway, thank you.
Thank you. All right, we are wrapping up public comment on agenda item number 3, cannabis pet products. And also would like to reference for the public that we are posting, we did receive the memo that's been referenced. We received one of them late yesterday, and it's being posted on our website, so it'll be available probably later this morning, I would say, or early afternoon. And if you've already spoken on this topic, we are adding one opportunity to speak on this topic. So if anyone has not spoken on this topic, please go ahead and raise your hand. Dominic, I'm sending you a request to unmute. Go ahead.
Hi there. Thank you. Once again, Dominic from Infinite Cal. Just wanted to say 2 things, or one thing and then give one suggestion. First, while personally I agree that it is important to have a vet's recommendation for any of these products, I am slightly concerned that adding that as a piece of regulation or requirement may turn people away from purchasing these products in dispensaries. So that is one thing to consider. These products are already available with no limits on how much THC or CBD or other cannabinoids can be in them in smoke shops and online. And there's no safety test required for those products either. I think if we are really trying to keep pets safe, that is something that we should all be working to find ways to easily turn people to dispensaries and not put up barriers that would make it more preventative. Second, regarding lab testing specifically for these products, I think for labs wanting to test pet products, there does need to be an extra level of scrutiny applied to the methods. Maybe that can come in the form of a specific PT requirement for testing these product types. But yeah, it's something to consider, especially given the results of what we've seen through the Weed Weeks article and LA Times. Thank you.
Thank you. All right, last call for public comment on agenda item number 3. All right. Would you like to wrap up comment on agenda item number 3?
Yes, moderator, if we could please close comments.
All right, comment period is now closed. Thank you.
Okay, so we have heard from the public, and I'm grateful for the input. We do have to have some conversations about recommendations, or Antonio, what do you think? Do you feel comfortable making any motions towards this? Because one of the things I'm wondering is we didn't get a chance to look at some of the written public comments, and I know that there is a lot of valuable information in there. I do have a concern about the cytochrome P450 interactions with whether we're talking about food, treats, supplements, things like that. But I also, as a pet mom myself, I understand the importance of having these products available too, and have them be easily accessed in dispensaries where, in a perfect world, these are well tested by laboratories, because the access that we have to hemp products outside of the dispensary is immense. And due to the fact that there is a quality control issue with those products, I do think it's problematic that we don't have them available in dispensaries.
Yeah, so as far as today, I definitely think we need to review the memo. It wasn't available to us prior, so I think we have to get more of this feedback and review it. I would then lean towards you as the chair to present these at the main committee in a way for us to discuss, and hopefully those updated recommendations coming through will have that information in context. I love for us to be able to meet again and have a separate conversation, but that's not unfortunately probably going to happen. So yeah, so that'd be my thoughts, that you and I can discuss any questions or solicit more feedback, right, as we discuss from the public, to then be present at the main committee meeting where the suggestions will then be discussed by the entire committee.
I think that is a very sound suggestion. Thank you.
But as far as that, I mean, I would love to hear from you. I mean, I know it's just you and I talking, and we may not be the experts here. And to the doctors and everyone that spoke, is that this is the forum for you to get that opinion out there. And like the other doctor did mention, that there are applications open for the TAC. So please feel as if there isn't a proper voice on this committee. Please apply and sign up. One of the big questions I had in my mind, I was hoping to hear more of, about cannabis products that should or should not be allowed. Are there any concerns? Are you aware of any major concerns for product types with pets? I mean, because I'm thinking more edibles. I'm not a dog person, nor do I have any pets. So I was just thinking edibles would be the only type, but are sublinguals and other things going to be used, or, should there be any kind of restrictions on products allowed? I'm guessing we don't want dogs vaping. So, I mean, like, how do we, how is that something we need to consider, or will all these products fall into the form of an edible? Because I don't want to be oblivious, but also, I'm just trying to understand
Yeah, absolutely. Well, there's definitely the possibility there have been tinctures in the past that have been available for animals. And then there's also the possibility of concentrates if somebody had an animal that was seriously sick, because I know that there have been some research in the past on CBD oil and squamous cell carcinomas and things like that. But we also have to go back to, if we're dealing with CBD and especially concentrated CBD, and these animals are on other pharmaceuticals, there's a possibility of a cytochrome P450 interaction, just like there is in human beings. So, do we have these available in dispensaries and people are told that that they should be talking to their veterinarian around dosage? I think that, I feel like in some ways the bud tenders get a bad rap, like they're giving unsolicited healthcare advice, where, maybe what it is that we should be, making sure that they're educated to know that they can talk about the products that are there, but that along with a label, they should be telling people, don't ask me for advice on these pet products. You need to talk to your vet. I mean, that's I think one of the biggest things. I think that I think that using the argument that bud tenders shouldn't be giving advice is also limiting access for pet owners to be able to use these with their animals. I know for myself, like, even just looking at dietary, restrictions for my cat, if they have to have a special sort of food, I would rather be able to get a recommendation from my veterinarian and buy it from a store than have to go to the vets to get it. Sometimes it's not always convenient for pet owners to be able to do that, nor is it efficient.
No, that totally makes sense. And what I heard earlier on, I know it did evolve into kind of an approval, but I see it as more a warning saying that you should seek the advice of a veterinarian due to the things like size. And I mean, I would be concerned now hearing about concentrates. Are the same solvent allowance that we use for humans, is that going to be okay for pets, especially small dogs or something as such, right? Who I would think would be way more sensitive. So I do agree that there should be some type of warning or advice that, seeking a medical professional. It should be the same in cannabis, to be quite frank. I mean, for adults, excuse me. It should be the same for humans. But yeah, I definitely think there should be some kind of warning, because, yeah, if you give a dog a whole pack of 100 milligram, you give a dog a whole entire pack of gummies, edibles, whatever it may be, a tiny dog versus a big dog's gonna have a totally different experience, just like a human would. So, I like the idea of a warning, but certainly not requiring some type of veterinarian recommendation. And then there was a comment about the pet owner may not be registered medicinally. Well, that concern isn't there, because this will still be sold in adult use stores, I suppose, right?
Yeah. Yeah, I
So,
think that would be, I think it would be wise to be able to allow that. I mean, when I think about, like, when you get prescriptions for pets and you have to get them through Walgreens or something like that, there's you don't have to get a special medicinal recommendation for the pet. You don't have a special card or anything for them.
mhm.
It should be easy for the pet owner to be able to get it through the dispensary, through in the adult use market. But you also brought up a point that I think is very important, which is the fact of what solvents are being used and how it's being tested, because these animals, I mean, we already have some issues with, as we know, with what's happened in the
Yeah.
news. Um, but these are very small animals, and so something like that could be even more deadly for them. So what would you, what are your thoughts on recommendations for more stringent lab testing for these as well? What are your thoughts?
I mean, I think you have to speak to a physician or, a veterinarian about what solvents are a risk to dogs that may be different than the current list. I don't have that information. I think this is what we need to solicit some of these organizations to come back with. Are there, different concerns for solvents or microbials or anything? Honestly, I mean, we have a zero tolerance for microbials in California, but are there other ones that maybe we're not testing for the human consumption, but the dog should be aware of? I mean, I think the entire safety panel should be reviewed if you're going to make it a true medicinal market. I know that calls for more work, but if you really want to make this about medicine, all those things should be reviewed when you're looking at pets versus humans, in my mind.
Yeah.
I don't know if that creates a whole different oversight system, but I definitely think that there should be some level of review to be responsible to these pet owners to ensure that these things aren't, problematic. And maybe all these things are in that memo that the group kept speaking about, but again, we haven't seen it yet. So that's something that I think I put on you to consider as you bring up suggestions to the larger committee.
Yeah, I am in complete agreement with you. I think that those are really good points to bring up. I think that when we are considering this, this is something that I think a panel of veterinary experts should be helping drive for good policy. And even, not even just the cannabinoids and the testing for pesticides and what have you, but also the basic, what would be considered the inactive ingredients and how do those affect pets? Like when we're looking at tinctures with the base oil, does that affect pets? Are those oils that they're actually able to safely consume? And really like going back to one of the comments on the same standards as pet food, supplements, and treats for items that are not allowed. I think we need to have some really sound guidelines on that as well. I'm wondering, should we just, do we, moderator, do we need to make a motion on this, or can we put together some of the things that we've discussed and just bring it to the general committee next time we meet?
We're talking about that here now. The items are being posted at this moment. We received one letter yesterday and the other one was outside of our normal process. So we're going to be posting both. If we can take an adjournment for 15 or 20 minutes so you guys have a chance to review. I don't know how lengthy these items are. If you want to do it now, or you could do it as you were referencing to go with some recommendations at the main CAC meeting. That's up to you. But we have the items. They're being posted now to the website for public consumption. But that's up to you. If you want to take a break.
What are your thoughts, Antonio? I want to.
So, yeah. So me personally, the last comment I have is that the packaging, I think, has to be discussed. I think we have to make sure that we don't consider people chewing through our edibles packaging. So it's something that has to be considered. But as long as we can review it and then still decide to not make anything formal or lock in the recommendations that can be brought to the general committee, I'm fine with taking a break and taking a stab at a bigger discussion. Would we then have to open it back up to public comment again? Which I wouldn't be opposed to either, but those are the questions I would have.
Yeah, I wouldn't be opposed to that either, because I think that having a just taking a quick break and then going back to public comment, we could actually glean some very important information out of that that'll help inform our conversation as well.
So why don't we take a break until 10 a.m.?
That sounds great.
All right, I'll
That
put.
works for me.
So members of the public will be on a break until 10 a.m. That's about 17 minutes to give them an opportunity to take a look at the items. Thank you. All right, welcome back. I think hopefully everybody had an opportunity to review the materials. So next step is you guys can discuss.
Moderator, do we want to discuss or do we want to do a public comment first?
That is up to you, Chair.
I'd like to speak with my colleague Antonio. What are your thoughts? Do you feel like I feel like if we got public comment first and then had our discussion, we may have a richer discussion because we'll get some more input. But what are your thoughts on that?
That'll work for me. It'll make it a little more concise as well. Instead of us discussing public comment, us changing our mind. So now that everyone's had a chance to review some of them, I think a public comment would work.
I agree. Could we start public comment, please?
You bet. Thank you. We are now going to reopen public comment on agenda item number 3. If you've already commented, please feel free to comment again once you've had an opportunity to review the items on the website. If you'd like to make a comment, please raise your hand by clicking the hand icon next to your name if you've logged onto the meeting, or by pressing *3 if you have called into the meeting. Everyone will have 2 minutes to speak with a 30-second warning. And with that, public comment has been reopened. So please raise your hand if you have a comment. All right, anyone have any more public comment on agenda item number 3? Jeff Pollard, I've just sent you a request to unmute.
Hi, thank you. So I want to start by saying these are excellent questions that are posted on your CAC agenda today. And I will admit bias in that I participated in the Veterinary Cannabis Society's answers that hopefully you've had an opportunity to read in our June 13th memorandum. And I want to admit, in addition to my present VCS advocacy, I was chair of the Veterinary Medical Board's committee that was tasked with making guidelines for veterinarians to discuss and recommend cannabis to our clients and veterinary patients. That was in 2018 through 2020. It spanned two laws. Generally speaking, I will say that veterinarians are overall very new to cannabis. We didn't learn about this in veterinary school. Only in the last couple years has any veterinary student been taught anything about it. So we're kind of naive. We're familiar with it as a toxin. And as you know, THC is unequivocally the limiting cannabinoid. That said, doses of 3,000 mg per kg did not kill a dog. So there are multiple things to consider. And of course, product contamination and possible drug interactions are issues we need to address. And I agree with everything previous commentators have made about guidelines and recommendations. I don't have a horse in this race. I just want a safe product defined as truth in labeling and the dissemination of accurate information. And the chair made a good point in a previous comment about not painting all bud tenders with a negative broad brush. But there's a conundrum of weighing no information versus bad information. And unequivocally, this information should come from the veterinarian.
Thank you
very much.
Are there any other commenters on agenda item number 3? Samantha de Trinidad, I just sent you a request to unmute.
Hi, good morning again. I spoke earlier, so I hope it's okay since we sort of reopened the second round. Mr. Fraser had mentioned before we went on break some thoughts on packaging. And while I want to be cognizant of the strain that this might put on manufacturers, distributors, even retailers when you consider shelf space, I think maybe it's worth a conversation about making something that's kind of more in line with what you might see at a pet store or something that again comes from a veterinarian. So maybe that means like a thicker type of plastic when you think of things that are typically presented in like a pouch form, like dog treats, or again something with forgive me, I'm not a huge pet person, but if there's like we have child safety packaging, if there's like a version of that that exists for pets, just something to sort of assuage the people that have fears of legitimate fears of overdosing and even eating things like the packaging itself. Thanks.
Thank you. All right, or we are going to wrap up public comment on agenda item number 3. Are there any more comments? All right, it looks like we are completed with public comment.
Thank you, moderator. Let's close comments then.
All right, comments on agenda item number 3 is officially closed.
Thank you. Okay, so we've had some chance to review these public comments. Thank you so much for submitting them. A hearing from the public is incredibly important so that we can help drive sound policy. As I was reading these, I was also thinking about terpene toxicity. And I know as a cat owner that is something that I think about as far as using essential oils and things like that. And I know that when we're looking at whole plant medicine, that isn't going to be as much of the issue. But I think that when we're making our recommendations to the CAC, we should ask about talking to experts that may know more about that to make some recommendations when we're looking at concentrates, whether we're looking at tinctures or oils or things like that, because in the human consumption cannabis industry, terpenes sometimes are reintroduced into products. Sometimes they're botanical terpenes. Sometimes they're terpenes that are botanical but naturally derived from cannabis. And I think that the work that we're doing with pets and cannabis is much more nuanced. Cannabis is nuanced anyway when we're looking at human beings and their bodies, but when we're looking at pets and they're small and there are different interactions, like there are lists of essential oils that when you use them even in an atomizer, that you have to keep pets out of a room. And so I would want to make a suggestion that we get a professional involved who understands that, who can can say, hey, that's not an issue at all, or that we can have some safeguards in place, because it's traumatic when you as a human being have a bad experience with cannabis, but for an animal who can't say what's going on and the trauma that would happen for the person or the family who owns the pet, I think that that's something that we may want to talk to with not only a vet, but maybe a chemist who would understand that better.
I would agree with that suggestion wholeheartedly.
What do you think, Antonio? I think I think we should have a conversation about packaging. I think that's very important. What are some other things that you think that we should include in our comments to the CAC?
I mean, so one, if you're just going down the list here, I'll just kind of jump around for the ones I think we should comment on. Is that for the prohibited types, anything that is to be inhaled or combusted should not be allowed under, the statute or this policy. I'm not really sure how to refer to it. With the cannabinoids, it should be the same available to humans. Those comments seem to be quite consistent in trying to limit, any kind of synthetic or synthesized cannabinoids, which will hopefully get rid of by controlling the hemp market. But that's not really that's not our conversation. But I want to acknowledge that from the comments is that we don't agree with giving them Delta 9, excuse me, Delta 10 or 8 or any of these converted cannabinoids. And then I think labeling is going to be very important. I think some kind of advisory, not a requirement to see a veterinarian, but reminding people that there are factors, whether it be the acute toxicity, the things that we're talking about here. I'm not sure how there are some recommendations in there, but I would just want to recommend that there be a warning related to potential toxicity and things that depend. I mean, I don't know how to describe it. Maybe some of the factors, right? Like size, condition, other medication, drug interactions, all things to be considered before you administer this product to your pet. And then finally, the packaging. I think, I think childproof doesn't do it because we don't expect children to chew through things. So I think that's what one of the callers just alluded to. So I think, whether it be the thicker plastic, whatever is required, and food, we're not calling it food. I've seen a lot of comments saying this isn't food, but whatever is required to try to keep food or pet medicine away from pets, unintended use should be applied here as well.
Yeah, I agree. I agree. And it was when I was looking at public comment and I was noting it was, let's see here. It was Dr. Shu's public comment on the cannabinoids and just that there is the CBD was available in hemp products. The one thing I'm wondering is if we should be making a recommendation. Well, I guess it wouldn't be so much of an issue, would it? The hemp products wouldn't be available in dispensaries. We'd be having CBD derived from cannabis. But my biggest concern with hemp derived products isn't, I think there are great ones out there, but whether we're calling it cannabis or hemp, it's a bioaccumulator. And so we want to be cognizant that there are controls to make sure that there aren't impurities that are involved in this.
Correct. And I think especially, the last question I just missed here. Yeah, we should have someone review those safety limits regarding pets versus humans. And there was a document that we received that had some suggestions in it. I don't want to take that for law, but I think there should be some level of review to ensure the safety limits, are there for pets and any sensitive conditions that they may have.
Yeah, I agree. I agree. So moderator, how shall we go about putting this together for a presentation for the next meeting?
I think you have the right to suggest now or submit before the general CAC, but I'll let Nina or someone clarify. We just can't discuss outside of this call. You and I cannot come together outside the call.
Give me a second. We're conferring behind the scenes here, so give me just a moment, please.
Thank you. I figured that's what the pause was. I appreciate your due diligence.
Jacqueline Campion's going to jump on and sort of guide us through this right now.
Oh, wonderful. Thank you.
Hi there, Jacqueline Campion, Deputy Director of Policy and Research. Chair Pan and Member Frazier, if you are able to make some kind of motion to guide the subcommittee discussion, that would be wonderful and very helpful. If not, the DCC will certainly review all of the information that has been received and take that into consideration as we're continuing policy development for these regulations. Thank you.
Thank you. Okay, then I would like to make a motion that we make a recommendation for consideration for the CAC around the public comment that we've just received. One, I would like to have them have us consider talking with a subject matter expert on terpene toxicity. Also, looking at packaging concerns. Also, the common methods for pet products that we should be considering are tinctures, liquids, chews, topical applications, and that we should not be considering any products intended for inhalation via combustion, which of course is common sense, but I would like to make sure that that's added in there. We want to make sure that synthesized cannabinoids will not be considered for these products, and that we would be exploring more stringent testing methods due to the size and metabolism of pets. Let's see, Antonio, what other things should we be considering here? Also the labeling of the products. We want to make sure that there's a warning label that pet owners consult their veterinarian prior to use. What else do you think, Antonio?
I think you hit on all of them. I love to hear what the DCC was able to take down so we can help them, just kind of tighten it up and make it up. But yeah, that definitely hit the main topics there. And we'll be clear, as far as more stringent testing, it could be action limits. I think a lot of the testing itself, people agree that the same type of testing should happen, but just for safety limits and consideration of animals instead of humans. That seems to be the general what I got from the feedback is that, yeah, the current tests we do, those are okay, but just let's make sure the safety limits are appropriate.
Mm-hmm.
We're working on preparing that motion, so
Thank you, moderator.
we're typing fast. So hold on a moment.
I believe in your mad typing skills.
All right. Listen to this. I think we've got. Yeah, okay. So the motion is to recommend for the CAC to consider talking with subject matter experts on terpene toxicity, look at packaging concerns, common methods for pet products that could be considered tinctures, chews, topical applications, and not consider products that require inhalation or combustion, to make sure that synthesized cannabinoids will not be considered, and to ensure that more stringent laboratory methods be employed, and that the labeling of the products make sure that pet owners consult with their veterinarian prior to use. Does that sound complete?
That does sound complete. And actually, a moderator, can we add with the warning label for the physicians, drug interactions, the possibility of drug interactions?
So for the labeling of products.
Mm-hmm.
Hold on a minute.
Sure.
Okay. So the last one, let me read the last one and then I'll read all of them for the record. The last one was amended to say the labeling of the products, make sure that pet owners consult with their veterinarian prior to use and include in this a discussion on adding warning labels regarding drug interactions.
That sounds wonderful.
All right. So I'm going to read the whole, all of them again, and then we can make a motion. Okay. Recommend for the CAC to consider talking with subject matter experts on terpene toxicity, to look at packaging concerns, common methods for pet products that be considered tinctures, chews, and topical applications, not consider products that require inhalation or combustion. Make sure that synthesized cannabinoids will not be considered. More stringent laboratory methods be employed, and the labeling of products, make sure that pet owners consult with their veterinarian prior to use, and include in this a discussion on adding warning labels regarding drug interactions.
My only
That-
comment, yeah,
Oh.
well, my only comment would be that instead of more stringent testing methods, more stringent action limits for compliance testing.
Ah, that's an excellent suggestion.
Yeah, because the testing methods are fine. It's more of just the limits for pets versus humans.
Wait, so can you say that again, please?
Please consider more stringent action limits for
Action.
compliance testing. Yes, the action limits themselves are the concern. Like failure limit. I believe the regs refers to it as action limit as well. Yeah, action limit.
So hold on, I'm waiting for Angela. Okay. All right. So I'm going to reread one more time, all of them. Stay ready. Recommendation for the CAC to consider talking with subject matter expert on terpene toxicity, look at packaging concerns, common methods for pet products that be considered tinctures, chews, and topical applications, not consider products that require inhalation or combustion. Make sure that synthesized cannabinoids will not be considered. More stringent action limits be deployed in laboratory testing and labeling of the products to ensure that make sure that pet owners consult with their veterinarian prior to use, and include in this discussion on adding warning labels regarding drug interactions.
Yes, and actually, as I'm looking at this here, I'm wondering if we should add in the labeling the in case of accidental overdose contact a health professional immediately, and also if the animal's condition worsens or does not improve, stop product administration and consult your veterinarian. Safe use in pregnant animals or animals intended for breeding has not been proven. Sorry, I meant to add that.
You want to add specific language to it? I thought we were going to consider.
Oh, that's
You
true.
want to add that specific language? Is that what you're trying to do with this one?
Yeah, I want to consider specific language, not actually lock it in. I just want to make sure that we're giving them all the information that they need when we meet.
All right, give us a moment. Hold on. All right, let me read what we have for that last point and see if this works. Labeling of products. Make sure that that pet owners consult with their veterinarian prior to use. Include in this discussion on adding warning labels regarding drug interactions, and that in case of accidental overdose, contact a veterinarian immediately and discontinue use.
Yes,
Does that capture it?
I believe it does. Antonio, what do you think?
I agree.
All right, I'm going to read. Yeah, I'm going to read everything in its entirety one more time for the record. So, the recommendation for the CAC to consider talking with subject matter expert on terpene toxicity, looking at packaging concerns, common methods for pet products that be considered tinctures, chews, and top of applications, not consider products that require inhalation or combustion. Make sure that synthesized cannabinoids will not be considered. More stringent action limits be employed in laboratory testing, and the labeling of products make sure the pet owners consult their veterinarian prior to use. Include in this a discussion on adding warning labels regarding drug interactions, and that in case of accidental overdose, contact a veterinarian immediately and discontinue use.
Yes, that sounds great. Thank you, moderator.
Okay. So do we have a motion?
Yes, I would like to make a motion to address this to the CAC using the language that you just described.
And I'll second that.
All right, motion passes.
Okay, so now we're going to move on to our fourth agenda item, recommendations for future agenda items. Do we have any topics that we would like to see at our next committee meeting, subcommittee meeting, I should say?
This is from the medicinal use, right? Specifically to this subcommittee.
Specifically for the medicinal use, yes.
I mean, in my mind, I'm always trying to, strengthen the medical market. I know we try to see it as one, but I do think patients have, continued to lose access to some of the traditional medicines that got us here. So I don't really know what form it is, but some way to incentivize retailers and manufacturers to produce these products again, whether it be better tax discounts. I mean, like something that is going to incentivize the medicalization again, focusing on those types of products, whether it be for adolescents, for seniors. I just continue to hear that a lot of the products that people were used to getting in California prior to Prop 64 just are no longer available on the retail shelf. And I don't know exactly how to frame that, but just more accessibility would be the simplest way to say it. And if we could agendize something along those lines, I would definitely think that would be a welcome topic for a lot of the consumers and patients here in the state.
I agree. I think that one of the things that comes up when we have this conversation is that the state medical program, a lot of people don't even realize that it still exists. And also the high cost of having a card, especially if you are critically and chronically ill and low income, it can create a barrier. I know there are some counties that do allow free cards, but like in San Francisco, it's a reduced rate, and even that $50 is quite a bit for the average patient. I also think that having a conversation about streamlining that process and having it be available online, especially because diversion is not going to be an issue where it was in the past, especially during the 215 days. That may be a good conversation as well. All of that together, if we're able to get more people who are actually participating in the medicinal programs, perhaps that will also help these products be more readily available in dispensaries, because I think dispensaries aren't seeing as many medicinal patients as they were before. They're seeing patients, but they're accessing through adult use.
Exactly. That's exactly what they're having to do. Or the hemp market, unfortunately, as they have to. And then the last thing I would say is any kind of update or recommendations for SB 34 that passed a few years ago, I believe now, about retailers being able to designate the donations for a qualifying patient or caregiver. Just feedback from the industry about any barriers to doing so, or anything that's going well or that would help the programs. Also, in an effort to encourage patients getting affordable clean cannabis as well.
I agree. I'm wondering if this would be a forum to be able to make a recommendation around because these programs are supported by the generosity of the industry, and as we both know, this is a very trying time, and still these companies are still remembering the spirit of compassion and generosity, and there are still donations being made. But in order to encourage more growth and to be able to help more people with it, I wonder if we could have a conversation about some sort of how would you call it, like a
Incentivize more people to do this.
yeah, if it was a way that I know on the federal level, of course, we aren't on a federal committee either, but if there's any sort of tax incentives or some sort of incentive that we could discuss to be able to help propel this.
I think that's the feedback I'm looking for from the people that are doing it. I mean, there's some great actors right now that are supporting these programs. If they could come together and give us that feedback, what they believe or what's hurting them currently while participating, that's exactly the type of conversation I think we should facilitate.
Yeah, I agreed. Okay, so do we want to discuss anything else before we open up for public comment?
Those are only two suggestions I have. I don't know if this goes to public comment or not, but we can ask the moderator though. It's a discussion only.
Oh, well, okay. Well, discussion only for us, but then also doing public comment for the future subjects. Let's hear from the public moderator. Can you please open the floor for public comment?
You bet. We are now taking public comment on agenda item number 4, recommendations for future agenda items. If you would like to make a comment, please raise your hand by clicking the hand icon next to your name if you've logged onto the meeting, or by pressing *3 if you've called into the meeting. All commenters will have 2 minutes to speak with the 30-second warning. You'll have 1 opportunity to speak, and please keep comments limited to this agenda item. So with that, we will move to Judy Strang. I've just sent you a request to unmute.
And good morning. When I was listening to the comments for item 3, something that occurred to me might be useful as a future agenda item would really enhance community feelings about marijuana dispensaries in their neighborhoods if they felt that DCC was doing enforcement, be it either products for pets or products for people. I don't know what your clout is at the level of enforcement, but if we could have some sort of report that would give us some idea of what's happening, how often they're coming, how they decide it as to which licensees to check. Do they have a clear process when people send them complaints, I guess is the word to use, that they're being responded to? Just an update. We realize the world isn't perfect by any stretch when it comes to enforcement, but if we could just have some sort of update, I think the public would feel much better.
Thank you. All right, comment period is open for agenda item number 4, recommendations for future agenda items. All right, we are coming to a last call for agenda item number 4, public comment on recommendations for future agenda items. Please raise your hand if you have a question. Sarah Armstrong. I've just sent you a request to unmute. There you go.
Everyone hear me okay?
Yes.
Okay. So in terms of talking about why medical products are disappearing off dispensary shelves, I would hope that you would invite some operators to come and talk about this. I'm unclear actually how many medicinal products have gone out of business and are no longer available. And if that's not the case, why they disappear off dispensary shelves. And I think the only people who can provide insight into that are the dispensary operators. And of course, you have the UCBA, which is a trade organization for dispensary operators in LA, and they also have a coalition of smaller trade groups across the state. So I'm sure they'd be glad to come and talk about it. In terms of the medical marijuana ID cards, there was a movement to require only that you have a valid doctor's recommendation to obtain the sales tax waiver. And David Hua of Meadow actually started working on this issue and circulated a letter, which my organization, Americans for Safe Access, signed, urging the state to make this change. It might be interesting to have him come talk about why and what progress has been made. We do have AB 2555 going through the legislature now, which is a renewal
30 seconds.
of the sales tax exemption. And I would really like it if you would invite Richard Miller and Kimberly Cargile, who operate one of the largest compassion programs in Sacramento, to talk about the expense and time and what goes into a true compassion program, so that we might obtain insights into what we can do to incentivize more of these programs across the state. Sacramento only has 2 compassion programs, Albeit.
Thank you.
Kimberly.
Thank you. Candace Hawes, I've sent you a request to unmute.
For holding this meeting and allowing me to speak. I just want to thank Antonio Frazier for making his comments about proposing SB 34, the California Cannabis Compassionate Act, known as SB 34, to be placed as a future agenda item, and also Sarah Armstrong, who just spoke about that previously. AB 2555 is a bill that's on our legislators' desk this year, which would renew parts of the bill that's expiring. This is an important bill that helps provide medicine to those that can't afford it, which is expiring. And there's changes that we could make that would make it better moving forward, including things that Antonio talked about, which would be incentivizing the participants. Also, we can only give these products away for the year that the testing results are valid. But we've talked about, the operators that provide these products, including Glass House or dispensaries, that, we can only give these products for the year, but it would be nice if we could possibly have a period beyond that year. There's certain products, like medical products, that aren't necessarily spoiled, but we just can't technically, donate them past that year time. But possibly we could have, another month where, we can't technically sell them, but we could provide them as donations to patients. So there's, changes that we could make to this SB 34 program that could make, it more beneficial to patients. So we appreciate putting this on as a future agenda item. So thank you guys so much for your time.
Thank you. Dr. Shu, I've just sent you a request to unmute.
Thank you. I think one thing to consider is if it's possible for either the DCC or the CAC to communicate with veterinarians that in California, they are legally protected and they are allowed to discuss and recommend cannabis products to their clients. And they have been able to do so for years. That's the whole reason why we got AB 2215 and AB 1885 passed, is so that veterinarians can discuss and recommend cannabis products to their clients. It's the majority of the pet owners that I talk to still tell me that their veterinarians are under the impression that they can't even talk about cannabis to their clients. So while it's important to have warnings on the products to say consult with your veterinarian, the reality is that majority of the times when the pet owners consult with their veterinarians are still under the impression that they cannot discuss or recommend cannabis products with them. And so we really need an informational campaign to go out to California veterinarians, letting them know that they can discuss and recommend cannabis products with their clients. Thank you.
Thank you. All right. Are there any more comments or recommendations for future agenda items? It looks like we are done with public comment on agenda item number 4.
Okay, so seeing that there are no more requests for comment, moderator, can you please close the comment section? And I want to thank the members and public for your suggestions. Hearing from you is very important to us.
Yes, public comment is closed and this meeting is adjourned. Thank you very much, everybody.
Thank you.